Okay.
So have we got the audience in then, Charlotte? Is everyone?
Yes.
Right. Okay.
Yeah.
Well, welcome everyone to the 43rd webinar in the Reclaim and Greening series. So I'm standing in for Prashant today, who's away. So can we have the next slide, please, Charlotte? So just to give you a bit of background on the two networks, so they're both headed up by Prashant Kumar at the University of Surrey. So the Reclaim network has been going for some time now. I think it runs until next March, and you can see the key people involved with that here. And then if we go on to the next one, Charlotte. And the Greening network is quite new. So we started this a couple of months back. So you can see there's a few more people involved with that, including me. Sorry, I should have introduced myself. I'm Nicola Carslaw from the University of York. So these are the people involved in the Greening network. So these Reclaim seminars are being run jointly with Greening until March, and then they will just turn into Greening seminars. You can find out more information about both of these projects at web links that I think are provided on in an upcoming slide. Next one, please, Charlotte.
Sorry.
Okay, so I think I've just said some of this. So these webinars are going to carry on until October 2027. So there's one a month, first Wednesday of every month at this kind of lunchtime slot. And the format is that we have two speakers, and you can see all of the previous webinars on the YouTube channel, which reminds me that I need to tell you that this webinar is being recorded. Okay, next one, please. So this is just a summary of some of the Reclaim activities that have been going on. So you can see there's a variety of things happening around urban green space, workshops and other engagement events. And again, you can find out a lot more information if you visit the website if you're interested. Next one, please. So one thing just to highlight with our Greening network at the moment is that we have applications open for some mini fellowships. So you can see details here. You can scan the QR code as well. And basically what these are going to do is provide opportunities for short-term placements around knowledge exchange, all to do with indoor greening infrastructure and environmental quality. And it will provide £2,000 per fellowship for non-salary costs, so things like travel, subsistence, consumables. And we're really looking to try and enable collaborations across academia and industry and community organisations as well. And again, you can find out more information about these fellowships on our website. Next one, please. Okay, so just to briefly introduce our speakers today. So this is webinar 43, as I said. We have two speakers. We're going to start with Jens Thomas, who's the Technical Director at Farm Urban. And he'll be talking about vertical farming in the urban environment. And that will be followed by a talk by Ian Sinha, who's a respiratory paediatrician at Alder Children's Hospital, talking about indoor environment and children's health. So just to give you a bit of background about Jens before we go to the presentation. So he's the co-founder and technical director of Farm Urban. He has a background in computational biochemistry and high performance computing, and he led the development of Farm Urban's pioneering urban vertical farm, and now oversees the company's technical activities and research activities into innovative and sustainable ways to grow food in urban environments. And then the findings are used to deliver robust and efficient systems for urban food production, with integrated educational outreach programs that aim to engage and inspire people to become more aware of the need for a more sustainable approach to food production and consumption. So with that, I will hand over to Jens. Please put any questions you have in the Q&A, and then we will come back to those at the end. So over to you, Jens.
Thank you so much, Nick. So let me share my screen. Okay, so firstly, thank you so much for the opportunity to speak, and it's a pleasure to be part of this this Greening network, as I hope I'll show in my talk. Like the kind of aims and purpose of the network is really so well aligned with what Farm Urban are and what we're trying to do. So as I said, I'm the technical director and co-founder of Farm Urban, and we're a Liverpool-based social enterprise that specialises in urban food growing, particularly hydroponics, but also engagement and outreach. So we're a social enterprise, and we're very much a purpose and values driven organization, so that the why about what we do is really important to us. So I'll start with there before I explain the kind of the how and the what we do. So the kind of why is that we believe we're on the brink of a human-led transformation to a more sustainable future, and that by 2050 our towns, cities will have become greener, healthier, more inclusive. So currently, most of the world's population, I think, lives in cities, and that the proportion is only set to increase as we go on. But most cities nowadays look like the picture on the left, which is these kind of sprawling concrete jungles that are not good for the planet. They produce huge quantities of waste, of pollution, and they're not good for people either. They're not really healthy, thriving environments, but that's the environment that most people live in. So if we're going to create a more sustainable future, we really need to address cities and look how we can fix the problems there. But we believe that transition is already underway, and I would say this network's a kind of start of that. We're moving more towards the picture on the right, where cities are green, verdant places that are supportive of people, supportive of the planet, and are really part of an infrastructure. And it's the way I see it is that it's kind of like cities. The old model of cities, you would come along and you would flatten the natural biodiversity, you would remove forests. But in the kind of the new model, as I see it, it's almost like you're just raising up that natural biodiversity. So it's still there, but you're creating more space because you've got vertical spaces as well that you can grow on. So it's blurring that transition between the rural and the urban to create really green, vibrant, healthy cities. So because of that, our mission statement is to transform our cities and towns into greener, healthier, more inclusive places. So that's really what's driving what we do. And because of that, and because we're a social enterprise and the why is what's key to us, our impact aims are really important. And everything we try and do, we ensure that it aligns with these 5 impact aims. So the first is respecting the planet. So the environment is key for us, and looking after Mother Earth. Partnering with our community is essential. So we really want everything we do to be linked into the local communities where we work, supporting them and being informed by them in what we do. Improving health and well-being is vital, and that's why we've been and the project with Ian that I'll talk about at the end is really exciting for us, and a real kind of example of, I think, where we can go. Researching and innovating is also key. So we started in a university context, and we've maintained those close links to academia, and that's why being part of this Greening Network is, again, it's so exciting. It kind of maps everything we do into the where we've come from. And then the final bit is creating learning opportunities. So probably half of what we do is education. So it's really important to us that we're educating and inspiring people about what we do, to explain why we do what we do and why it's so important. So the farm urban journey started when I met my co-founder Paul, and we were both doing our PhDs at the time at the University of Liverpool. And they were in very very technical subjects. Paul was in epigenetics, I was in computational biochemistry and chemistry. But we met through a shared love of permaculture, which is really about soil-based organic growing. And that kind of love of the soil continues, even though we're actually not growing soil ourselves, growing in soil ourselves. But what kind of brought us together was a shared interest in something called aquaponics. So you can see a small scale aquaponics system here, and this is actually a small system that we use in our education programs. But in aquaponics, you grow fish and plants together in a closed loop ecosystem. So fish, the waste from fish contains ammonia, which, if you don't do anything about it, builds up. It's a toxin, and it will eventually kill the fish. But there are natural aquatic bacteria that will inhabit any aquatic ecosystem, and they can oxidize that ammonia and turn it into nitrate, which is an organic plant fertilizer. So you can take that nitrate-rich water and you can give it to plants, which are grown hydroponically because they're grown in water. They take up that nitrate, so they get this amazing fertilizer. But in doing so, they clean the water, so you can let the water drain back to the fish. Your fish are getting clean, fresh water, and your plants are getting this amazing organic fertilizer. So that's great because it shows an example of a closed loop ecosystem. And even though we're working with we're growing in water, these are actually systems are actually 90% more efficient in terms of water use because it's recirculated, as are the nutrients when you're growing hydroponically. But that growing in water and the hydroponic element is what allows us to grow at at great scale. So because we don't have heavy soil, we can vertically stack the systems, and we can grow kind of vertically up walls. And with the advent of energy efficient LED lightings, the economics become possible to do this in cities, but we can also do it anywhere. You can grow in basements, on rooftops, any unused space. So, and these systems are roughly 100 times more efficient in terms of land use than conventional agriculture, which speaks to that interesting soil that we have, because by growing in these ways, you can take some of the pressure off the land and grow more sustainably on the land and grow some of the crops within cities. So that's what started us on our journey. And we raised some social investment for our first farm, which you can see in the main picture here. And that was actually in a basement under a school in Liverpool. So it's an amazing space. It was a 200-year-old Victorian vaulted warehouse, and the school wasn't actually using the basement at the time. So we cleaned it out, installed the farm there, and that really set us up for the kind of the I guess the framing of the model that we have, which is to take advantage of unused existing space. So rather than build huge factory farms on the outskirts of cities, these are small scale farms taking advantage of space that's becoming available in cities as more and more consumers move out, and eventually as cars move out. And so farms that are small and linked directly to their local community. So this is really about changing. Said our mission is to transform cities, so we're doing this by sort of bringing a new economy into cities that's doing something really valuable, creating fresh produce, but it's an entirely new economy. So and food is the basis for restaurants, for food products. So it's kind of the basis of an economy that you're bringing into a city, but providing local employment as well. And we really want our farms, if possible, to be sort of focused on their local community. So if a community has a particular need, for example, we work with Ethiopian community that they really wanted us to grow Amara kale, but we can respond to that need and really focus on the community. So that's kind of where we started, and we're now in the farm that you can see in the picture on the right. This is a little bit further outside of the city centre, but again, like half an hour's walk from the centre of Liverpool on the docks. But again, this wasn't an optimised space for a farm. This was actually the old Uber offices in Liverpool. So again, really exciting for us to take a new space and look at how we can turn that into a functioning farm. And the model that we've developed actually came from the fact that at the time we set up our first farm, we couldn't afford a packing plant. So we ended up with a model where we harvest the whole lettuce whole. We don't actually pluck the individual leaves, and then we put it in a box with a cup of water, so that the lettuce is still living when it goes to our customers. And that's so important, because what that means is, first of all, it's the freshest produce that you can have. So people have these in their kitchens, and then they just harvest the leaves they want as and when they want them, so that they're getting the freshest produce could you imagine, because you're harvesting it in your kitchen. So that does great things for the nutritional quality, but also there's no waste, because it's not sat in a fridge going off. It's out there living and growing. And on the subject of fridges, it doesn't need to be refrigerated, so it saves a lot of energy. But also for a lot of our customers that don't have fridges, it means they don't have to worry about that. And currently, we're really fortunate that all of our produce is funded to go to food banks by companies that we work with. So that food is actually getting out to the people that need it most, and the people we want to impact. But as I said, a lot of them don't have fridges, so this is a way to avoid problems with that. But it's these boxes going out into the community that sort of put us on the path to the next part of what we do. And it was seeing the impact that these boxes have, and the impact that food has when you bring it out into the community. And it was seeing that impact on people and behavior change, because that's really the key thing that we need to address. Because no matter how many amazing farms and systems we have, it's people's behaviors that drive the change. So it's by explaining why we do what we do, and the benefits that it has, that's really moved us forward. And it's what has led to set up Farm Urban's education program, which is about half of what we do now. So Farm Urban's education brand is called Roots and Shoots, and we have three main programs that we run under that kind of umbrella. So the first is the Future Food Heroes program. So this is a 6-week program for primary school children, where we teach them about sustainable food systems and how to advocate for the environment. So they get one of the produce pod systems, which is the small aquaponic system you saw in the earlier slides. So that gives them an opportunity to grow their own food. They feel empowered to understand how food grows, that they can actually grow it themselves. But they also advocate, and we've seen some amazing examples where we've had kids write to their MP to say that they weren't happy with the food and recycling systems in their local area, or write to their chef to say they wanted more fresher, better food in their canteen. So that's been really successful. We also have the Future Food Challenge. So this is a 10-week program focused on secondary school kids, and we get them to set up their own little social enterprise to create and design their own aquaponic food system for their local area. And what we want to do here is, rather than talk to them about the problems of the environment and all the issues, we want to get to see themselves as the innovators, the technologists, the scientists that are going to help us solve these problems. So we have an introductory event, usually at the university, which is great because we get them to interact with professors, with PhD students, so that a lot of the kids can learn to see that they could actually go to university, because a lot of the demographics we work with, none of the families would expect them to go to university. So we have an opening event. They learn about aquaponics, about entrepreneurship. They go away for 10 weeks. They do this program, and then we invite them to the farm, and there's a Dragon's Den style pitching competition where the different schools compete against each other for various prizes. And the final kind of education element that we do is our community growing project. So this is more focused on adults, and this is where we give them one of our edible wool systems, which you'll see in the next slides, and then we show them how to look after and maintain that. So it's bringing growing into spaces where it might not otherwise be possible, where there is no soil in the kind of the heart of cities. So we'll show them how to look after and maintain these systems. We'll teach them about hydroponics, but we also have a whole range of different elements around employability, around health and well-being. And we've seen incredible success with this, running it with the long-term unemployed, and also with people with neurological difficulties, and seeing the incredible impact that connecting people with nature can have on their health and well-being. So I mentioned our edible wools, and this slide covers those. So this is kind of a way that brings the two elements of what we do together in a really lovely way. So it's got the hydroponic growing, but also the community engagement. So these are small scale vertical hydroponic growing systems that can go into corporate spaces, into receptions, into workspaces, but also into schools, into community centres. And what they're doing is they're bringing that green environment into the spaces. It's indoor greening, which we know has loads of psychological benefits. The plants are purifying the air, but crucially, it's engaging people with food. So people can come and they can harvest the leaves to put in their sandwiches or in their salads at work. So it's reconnecting people with food. And we have an SLA where we will come on a weekly basis and take out the plants that have been harvested and put fresh ones in. But we really try and not just do it just as an SLA where we come and maintain the wall. We have a whole series of engagement sessions that we run around this. So we have hour-long sessions where we'll come in on a monthly basis, and we'll talk about we run cookery sessions, we run yoga sessions, breathwork sessions. We talk about sustainability, recycling, lots of different elements. So explaining all the why we do what we do and how people can be involved and how they can improve their own environment and health and well-being. And the final thing I wanted to talk about is the project we've been involved with Ian at Alder, which is developing innovative lighting regimes for nutritionally optimized hyperlocal living greens for Alder hospital patients. So that was a project where we were working initially with plant scientists at York University, so with Catherine Denby, who's one of who has our connection to the Greening Network, and looking at ways of improving the nutritional quality of our produce. So by looking at varieties that are particularly high in nutrition, but also looking at different lighting regimes and different ways that we can dose the plants with different frequencies of light at different times to improve that the nutritional density of the produce. And that's been really successful. And I should say the kind of genesis of the project came about from conversations with Ian, where he mentioned that even though he was a respiratory consultant, he was basically treating poverty, and that if the children that came into his clinic had the proper nutrition and then the proper kind of conditions, that they wouldn't end up in his clinic. So really, we're looking at ways of addressing those very early nutrition needs as a way of stopping people getting into hospital, which obviously saves a huge amount to the NHS and the public as a whole. So it's not just about the nutritionally optimized food, it's getting it to the people in the right way. And that's been some of the really exciting and interesting parts of the project. So we've had our boxes of living salad, and we've used those as sort of engagement vehicles. So the boxes have had recipes, they've had lots of information in them, but the boxes themselves have been a vehicle when nutritionists can actually, as they hand that box out, they can have the conversations with people about their diet, about their well-being, signpost them to the right places. So that's been really successful. And we've also worked with the chef at Alder Children's Hospital, John, who's been amazing. So he's taken a large part of that produce and then he's put it into the canteen at the hospital. So the staff and patients are getting this amazing fresh food, and it's extraordinary that we had the closeout meeting for the project last week, and the food he produced was just amazing. And a key part is also the engagement with the staff. So for this to really work, we need to get the staff on board, and Ian's been really helpful in that, in getting the staff engaged so they understand what we're doing, why we're doing it. And we've had a lot of press around the project. We were really fortunate that the hairy bikers came and visited us, and they were particularly interested in this project. So the final slide, just very briefly, this is kind of a vision that brings together everything that we do, and it was a project that was started by we had conversations with the council where they had a car park where they wanted to put a vertical farm, but we said, look, if you do this model, you'll have so much more social value and impact. And the idea is that you do have a vertical farm, but you also have a whole range of other growing systems, outdoor systems, soil-based systems. So again, you're bringing that incredible biodiversity in. You have smart beehives, but it's a community focused place. So you have maker spaces, you have a tool library, different things that can bring people in for training, so that they can be trained on all the different systems. And then we have a community kitchen in the centre where the community come in and cook food that's then subsidised to that local population. And one of the really interesting ideas is whether you could bring a kind of a medical framing to this, to actually have doctors bring their surgeries here and see patients in these incredibly healthy, verdant places where you can signpost to lots of different services. So I hope that's given you a bit of an idea behind who we are and what we do, and also our links to why I'm so excited by being involved in the Greening Network. So thank you, and I'm very happy to take any questions.
Thanks, Jens. I think what we're going to do is go on to Ian and then have questions for both of you at the end, if that's all right, given that you've got lots of connections going on. So let me just quickly give Ian a bit of an introduction. So Ian's a full-time respiratory paediatrician at Alder Children's Hospital and also Honorary Professor in Child Health at University of Liverpool. He holds national leadership roles in respiratory paediatrics. He's the clinical lead for paediatrics in the National Respiratory Audit Programme, NHS England North West Asthma Lead for Children, and has successfully accrued nearly £12 million for competitive research grants. He's got over 100 publications in peer-reviewed journals and has a particular interest in the roles of environmental adverse exposures and child poverty on health inequalities in children. And he's recently been commissioned to write a national strategy on health inequalities in children for the Royal College of Paediatrics and Child Health. So over to you, Ian.
Well, thank you very much for such a kind introduction, and also thank you for the opportunity to join your wonderful network today. It looks like you're doing some wonderful stuff, and yeah, it's lovely to join this webinar. Thank you also to Jens for that lovely talk. I was very well, we're very proud of what Farm Urban have achieved. You know, as fellow Liverpool people, we're proud to see their impact anyway. But being part of their work has been a real honour, and seeing them on the hairy bikers was a particular highlight. So as Jens quite rightly said, a lot of what I do with regards to respiratory health in children is simply just treating the manifestations of poverty that we see. One of the key ones being the air that they breathe, and so this is, I think, very relevant to a group who are interested in green infrastructure. I always start my housing talks with this slide. This was a photograph taken in, I think, 1970 in Glasgow. And I read an interview with this lady who's pushing this pram, and in essence, her or an account of an interview, and in essence, there was a point where they were in the house, and her husband had to run outside because people were going to demolish the house, because on the face of it, it seemed implausible that people would be living inside. That was 1970, and as we come on to now, we still see the fatal impacts of housing on child health. As with all these things, you can not really get anywhere without a huge number of collaborators, mentors, colleagues. Some of mine are listed here. You can see Jens somewhere on there, maybe the third from bottom, and we see our collaboration with Farm Urban as being one of our real highlights. But on here are some of our PhD students, and some of their work is coming up in my slides. This is a quote from Sir Michael Marmot, who's the absolute don of health inequalities in the UK. He said, if you need a case study of what not to do, the UK provides it. And that was largely based, or one of the things that's really pushed health inequalities to the top of the agenda is that if you look over time, generally people live longer than their grandparents across history. But in 21st century Britain, we're seeing reductions in life expectancy, particularly for women, and particularly for women, or almost exclusively for women, in the poorest decile of the country. Housing is an absolute shambles, and you can trace a lot of the political decisions behind that to the government that we had in the 80s, and it's now a shambolic state of affairs. And it's no surprise to those of us who've been interested in child poverty for some time that we have seen increasing rates of poverty, and now we're seeing record increases in the number of children, which is now numbering over 4 million, who are living in relative poverty. So we're not coming from a good place, and the picture that Jens put up before about the concrete jungles, yeah, we see huge amounts of poverty in cities, but we also see rural and semi-rural poverty in the UK as well. And what my research group is focused on trying to basically re-engineer a better world for children, better systems for children, and we come on to that later. The key thing about children, and as pediatricians, we've got a reputation of being like that lady from The Simpsons that keeps saying, oh, won't somebody think of the children? We absolutely do that, and we unashamedly do that. And the reason we do that is that, in our opinions, and we say this unashamedly as well, children are quite simply the most important thing in the world, and the whole world for us revolves around children. And we say they're 25% of the population, 100% of the future. Yet actually, when you look at policies in the UK, our colleagues in public health in Europe ask us why we hate children in the UK when they look at our policies. And it's not just a moral thing or because we like children. There are very clear arguments that childhood, from a biological perspective, is by far and away the most important time in your life. So in essence, if you look at your lungs, they grow really fast for the first couple of years, probably up until about mid-primary school, and then they grow kind of fast. Then you hit high school and they slow down. Then you enter your early 20s, and basically everything goes downhill there. So what you enter adult life with before everything goes south is what you're going to get. And you can trace that right back to the early years. So pollution becomes hugely relevant to children. Children are especially vulnerable to air pollution effects. This is what happens in these growing, developing airways, in this window of opportunity. And what we see is that pollutants cause direct cell damage, they lead to immune dysfunction, you get free radical formation, you have epigenetic changes, so changes to your DNA function, and the very intricate systems that we all have to clear mucus from our chest, that gets affected by air pollution as well. This was something that when I wrote a expert report for Ella Kissy Deborah, a little girl in London who died after an asthma attack, and posthumously this was put down to air pollution. One of the things you can see in her post-mortem report is changes suggestive of at least some of these, including the inability to clear mucus, and this leads to disease. This is Carl and Alice, two of our PhD students, who about 15 years ago, we were starting to talk about outdoor air pollution in pediatrics, and then not long after we said, well, hang on, children sometimes go inside, so we should think about the air that they breathe there as well. And they've published this quite nice review actually around poor housing and indoor air quality and the impact on respiratory health. And as you can see, it's reasonably complex, right? So these things don't just happen in one dimension. It's a complex interplay of different housing factors leading to different health hazards, which then play off each other to give you suboptimal health outcomes, including increased risks of asthma, particularly in children who are exposed to poor indoor air quality in the early years. It's only a short period of time that I've got, so each of these slides has been something that I've done a lecture on in the past. I'm giving you a real whistle-stop tour, but what I want to move on to from the biological impact here is where we're really thinking about air and living situations, and we've started talking about these as human rights. These lovely children here are holding the universal symbol for human rights that was designed by my friend Predrag, who's a human rights activist in Serbia. And this is a quote from him, that human rights are the greatest human invention in history. They're universal, they're inalienable, they evolve over time. And we've written down what those rights are for children. They're written down in the UN Convention on the Rights of the Child, which says that governments have a responsibility to try and ensure that children can fulfill their potential, right? They can live their best life and be the wonderful people that we know that they can grow into. And with that right comes responsibilities. For me, the key thing about human rights is that rights bring responsibilities and brings accountabilities. And so whose responsibility is this, right? If we're saying that children should live in situations that enable them to be happy and safe and live their best life, whose responsibility is it that one of my severe asthma patients, she's got some of the most severe asthma in the UK, wakes up most mornings to find a dead rat in her kitchen? Whose responsibility is it that this grandma knitted this cardigan for a baby who comes to my baby clinic? It was the baby clinic that I link with Jens and the Farm Urban team around. So whose responsibility is it that within a week of getting that cardigan, it's unwearable because it's covered in mold? Whose responsibility is it that when this mum cleans her house with expensive cleaning products every 2-3 days, and within 3 days she's seeing this level of mold underneath the windowsill and is told that she should dry her clothes in a slightly different way? Whose responsibility is it on the right hand side there that this family came to the UK having been basically chased out of the Middle East by the Taliban because they helped the British army? Whose responsibility is it that their baby sleeps on that mattress and they have to throw it out every week to get a new mattress for their baby? Rights carry responsibilities, and yet when we look at the structure and the system, the fact that the system is set up against working class families. So this little boy in the corner here is this gorgeous little boy died. He's called Awab Ishak. You may have seen his name because it was in the news a lot, because he died in substandard social housing. Well, it wasn't fit for an animal, let alone a child. And I was part of the team that wrote what's called Awab's Law. So I worked with the government on Awab's Law, where we basically put some responsibilities and accountabilities for social housing. And in doing so, I made some friends in various places. And this is the name I've written here. Imogen Tyler is a professor of sociology at Lancaster. She's a wonderful person, and she's written a fantastic book, which is the mantra of our health inequalities research team. And the book is the title of the book is the mantra. The book is called "Stigma is the Machinery of Inequality." And when her and I had been talking about respiratory work, she basically went down this route of thinking about necroeconomics, how the policies that we have, people live and die by these policies. Okay, these are written down on paper, but they're not dry. These are things that have a direct impact on people's lives. And yet, for all of the 4 families that I showed you the photos of before, they're all my patients, and those photos are things that they bring to clinic or send to me. And for each of them, there was a very clear narrative that they had been completely gaslit, which, whatever the past tense of somebody completely ignoring you and telling you that it's your fault or that you're making it up. And this is what somebody told Imogen as part of her qualitative research. They said that the air in the home they felt was killing us, and we were told that we were breathing too much. And that's not too dissimilar from what Awab's family were told when they had mold, and they were told that they should stop doing ritual bathing. By ritual bathing, this family were having a shower. This is people trying to live their lives in situations that are causing them harm. Mouldy homes and cold homes go together. I mentioned Sir Michael Marmot before. We wrote a report with him about cold homes, and I wanted to highlight two things from that report. The first was that the narrative around cold homes for many years, and I totally get this, I understand it, has been around elderly people living by themselves. And every time I visit my parents, I think this. I'm sure many of you are the same. But actually, when we released this report, we said this isn't just a consequence of or a thing with consequences in the elderly. This is a thing that can affect children. We were saying the very things we tell families not to do in order to avoid the risks of cot death are the things that you do when your house is cold. You co-sleep with pets, you put the fire on, so you wrap up tight. So there are impacts in the short term for children. The other thing that came out of this report is that if you look at how much it costs to heat your home in the poorest decile of the UK, after you've paid for accommodation, you spend 74 pence out of every pound on heating your house to a comfortable standard, which is exactly the same as it costs to feed your family according to national governmental guidelines. So if we're asking families to pay £1.48 out of every pound on heating and eating, then something's going to give. And so we see those tracks of the richest versus the poorest children diverging straight away. And we see that even before birth. But if you think about the babies wherever you are in the country today, let's think about Surrey. The babies in Surrey who go home to the warmest houses today will spend their calories on growing brain tissue and heart tissue and lung tissue and liver tissue. The infants going home to the coldest houses, and this isn't hyperbole, the infants going home to cold houses where they can see the breath in front of their face will spend their calories trying not to die in the next 6 hours, right? This is literally them trying not to be hypoglycemic and hypothermic. And so lung maturation is the thing that gives, and these are the sorts of days that lead to huge problems for the rest of your life and contribute to that reduction in life expectancy. So we set up a clean air clinic that I just wanted to talk about for a couple of minutes. This was pre-pandemic. We were sick of writing letters that said, I'd be ever so grateful if you might find the time to come and see this house. Thank you, because nothing happened. So instead, we started writing letters that said, I think your house could potentially kill this child. And that worked, right? So housing agency chief executive officers don't like getting those letters, and things really changed. And the impact of Awab's law has been immeasurable, I think, in my opinion. And similarly, the Royal College of Paediatrics and Child Health have picked up our clinic and a similar one, or one with similar aims in London. And we're now trying to spread these across the country. And this was a little boy who, in the absolute cesspit of Twitter, or X or whatever it's called now, the absolute cesspit of Twitter, out of nowhere I got a message from a journalist saying, can you see this mum who lives in Milton Keynes? And I saw her and her family that afternoon on a video call, and this was her little boy who was bouncing in and out of hospital with near fatal asthma attacks. And we tied together his medical history and went, look, you probably get hundreds of these letters saying my house isn't good enough. I'm telling you, this boy is at risk of a fatal asthma attack. And they moved, and now he's absolutely thriving, to the extent that even his autism has got better. The living situations that children find themselves, that we place children in, have a huge impact on every aspect of their life. And one of our other PhD students is about to publish it's been accepted, a systematic review showing the impact of housing on school readiness, the best thing we can do for these children is set them up well. And we took that air clinic, and we've actually kind of gone one step upstream and said, right, well, what we need to do is not need a clinic. We should not need a clinic. So now we just email the council if we get children who there's a problem, and then they just sort it out. So we've got that going, and we wrote about this in, of all the publications that I've had, the one that my mum is most proud of was that I was in the Big Issue. And so I always put this in because it makes my mum pleased. But we've now set up a Northwest Regional Health and Housing Task Force, which has been amazing. This is my last slide, because this is where I think we need to go next. Not just about air, not just about health, not just about asthma or lung disease or school readiness. What we are finding ourselves in is a world where we have a generation of children that we have completely left behind. They took the hit for us so many times, the pandemic being a perfect example, and yet we haven't paid them back for that. And if anything, things are getting worse for children. The digital world is expanding, their physical world is shrinking. There are threats and dangers that didn't exist 10 years ago, let alone when I was a child. This is a tenement block in a place called Barrow in Furness that we're using really as our sort of sentinel, whatever the word is, vanguard, I don't know. The first place where we tried to do this slightly different approach to how do you reimagine and redesign and redevelop the systems and the living situations of children. How do you redevelop the world for children? So we basically went up to Barrow, which is a place that's got real issues. And instead of having loads of quite boring meetings with a load of people who are a billion miles away from the problem, we spent the time talking to mums, and we spent the time talking to people who've had difficulties there, people who were previously addicted to drugs and things. And we just drove around, we walked the streets and understood what it was that they were talking about to a degree. This is a tenement block in Barrow in Furness. Children live here, and this place is infested with rats and pigeons. And it's in this building, if you are released from prison in the north of England and you've got nowhere to live, you get shipped here. So there's paedophiles, rats and pigeons. That's how we describe the world around the youngest children in the poorest parts of Barrow. So what we're really trying to do, and this is a step on the way to that wonderful slide that Jens had about how you can have green infrastructure around to make things better, to physically make the world better, is that we've been trying to see why, why is their infant mortality rate higher than it should be, even if you take into account their poverty? Why are their breastfeeding rates so low? Why are their smoking and vaping rates so high? And it's only by understanding things with those communities that you can start to see that the home that they go to is a crucial aspect of the world in which they live, and that we need to start better. And so we've been basically pushing from here this idea that you've got a square, and in each square, a corner of the square, you have something clinical, academic, the community you're trying to help, and policymakers. And unless you have all four of those together, everything falls apart. That, for the purposes of making a change, is the most important thing. We also learned, and this is a well-known thing in public health, I'm not a public health person, but it's a well-known thing that the action doesn't happen in a hospital or in a school or in farm urban. The action happens at the interfaces between those things. So as much as we talk about collaboration, I still think we fall short of what that really means for the people that we're trying to help. So to sum all of that up, poor housing, which is cold, damp, mouldy, infested, has both direct and indirect effects on respiratory health in childhood, but these are lifelong. We feel that these are an infringement on children's human rights, and there are societal, governmental and corporate vectors of disease that need to be tackled, and we need people to be tackling these at all levels, but especially at the highest level. And we use our medical expertise to advocate for families, but I love speaking to non-medics because you've got expertise in a whole different area that can also add to this really important story. And finally, I'd end by talking again about collaboration and saying that communication between us, between agencies, between different sectors, literally saves lives, and this is where we should be spending our efforts. And on that note, it's wonderful to see your fantastic network thriving so much, and thank you.
Thanks both. They were very interesting, different, fascinating talks. Quite depressing as well. I feel like, Ian, some of this stuff we've been discussing for years. I mean, if anyone's read the Marmot reviews, it's all there, isn't it? But why? What? I mean, it's more than about just throwing money at the system, isn't it? At the situation. So why? What do you think the big failings are? Where's the? It's. I agree. You need people to come together across agencies. You need more of a systems approach. But what are the real problems, do you think?
Yeah, it's a very good question. I'll answer it briefly, but we've got three golden areas, three big cracks that happen. Number one is that certainly, I guess even within academia, the primary goal of any system is to look after itself. That sounds very conspiracy theorist, but we see this all the time. Health, public health, education, the government, the primary goal of that thing is to look after itself and ensure it's and so children are not seen as a priority in there, and that's the second key thing, that there is an invisibility around women and there's an invisibility around children. And so why are we surprised that we've built up a world that's actually been designed by quite rich men? And why are we surprised then that women and children are suffering? So anything we can do to increase that visibility and say, look, this is the most important time, these are the most important people, this is what we need to do. And the third thing around the communication and about why things or people fall through the cracks in between institutions is that, to give a positive slant on this, the collaboration we have with Farm Urban is it's equal. We're equal. We're all pushing towards the same thing. None of this is about empire building or ego. This is all very much about a shared vision. And I feel when I look back over the billions of conversations that we've all had in our own institutions about how, trying to sort of force teams together like this, and you go, we already work together on the shop floor. It's you at institutional level, at boss level that can sometimes hold it back. That's what we say to our managers. And I think there's something about going through that whole square journey, clinical, academic, communities and policy together right from the start, rather than just a show and tell at the end of a little pilot project that doesn't go anywhere. People have pilotitis now, and we're sick of little £5,000 things. That said, your point about the money is also very crucial. This doesn't take much money. It doesn't take much money. We've calculated, and again, Jens's team is part of this. We're taking a really hyper local approach to things. So if you were to fix this across the country, it would cost millions. If you fix it in half a town, we think it costs about £15,000-20,000 a year to do this properly and start to put some kind of things in motion, so that then you can get the bigger grants for larger green infrastructure or whatever. But it's just getting it going doesn't take much money. And once it's going, if you've got that square, the money's there. It just needs to be redirected into something meaningful rather than nonsense.
Yeah.
Thank you.
It's a frustration, I think, working across government agencies as well. So it takes you all your time to track down someone in the Department for Housing or whatever they're called these days. And by the time you've tracked them down, the person in the health department you might want to talk to has moved on, or they've, so I think that cross-governmental department thing is challenging as well sometimes.
It absolutely is. And that was one of the drivers for so I think I don't know if anyone else has it now, but until recently we were and may still are, the only regional health and housing task force. And it would actually be great to bring in other people in there, engineers, social scientists, and it's not an academic thing, it's a very pragmatic thing with very tangible endpoints. But you're quite right, once you're all in the same room talking the same language, we all speak different languages even though we're trying to talk about the same thing, and having you all together as a team is better than people trying to piecemeal things together. You're quite right.
Yeah. Okay. Charlotte, have we got anything in the Q&A yet?
Not at the minute, no, that I can see. So if anybody has any questions, please put it in the Q&A box or in the chat.
Okay, so I might ask you, Jens, and maybe you can tell us a bit more about the slide you showed at the end with the amazing green infrastructure on top of a car park. I mean, is that actually coming to fruition? Does that exist, or is this the plan?
It's a plan. We came very, very close, but with there were various kind of funding issues that it fell apart at the last minute. So we actually got very close, and it's something that we've sort of put on the back burner. It's kind of what we're moving towards, and I think it's one of these. It's something that brings in many different kind of elements. I think I really felt what you said and Ian said about the kind of what it's like dealing with these big institutions and the big structures. And a lot of the time I just don't feel these institutions and structures are really fit for purpose anymore. They're so big, they're so bureaucratic, so complex, and they make things very difficult. Things that aren't very difficult become very difficult when you put them in these systems. And I think we need that. There's a real case for, and this is one of the reasons I moved out of academia into social enterprise, is that kind of small community organizations and social enterprise can be very nimble and can move in quite quickly, respond, understand the communities, and kind of link together. So that's why that model of that urban oasis still really, it's kind of where we're going towards, because it's bringing what we do, our expertise in, but it's also saying, okay, we can't solve this all together. We need to link in with the other organizations, the other agencies that are able to support us in our aims, and together we can have that really powerful impact. And I think by this idea of bringing in the kind of that link to the medical, there's a lot of kind of, you can have an incredible impact and also a lot of money through that as well. So it kind of it's a way of accelerating impact and bringing things together. So it's not something that we've got funding for at the moment. But it's beyond a pipe dream. It's like we have all the finance. We had it worked out. It was just that there was financial issues that meant literally we got to the final step for it going ahead, and then the money didn't come through. But it's really got us thinking about what's possible, how it can be done. And as Ian says, I think a lot of these things, particularly when they're taken out of the big institutions, are not particularly complex or expensive. It's like these institutions that can make them really complex and expensive.
Yeah. I mean, I wondered about putting something like that on a hospital rather than a car park. The concern I would have about a car park is just that the vehicles are producing pollution. And then how does that deposit onto the vegetation? That would be, and then people are eating it. That's the only thing I would worry about with that setup. But with I just imagine on hospital buildings, it's always really unpleasant waiting in a hospital if you take someone in for an appointment. But if you could go and sit in a nice green space like that, it would be quite pleasant, and maybe it would draw in volunteers to come and help in the hospital. And I can imagine that could be a really nice sort of hub in that sort of environment, perhaps. But
that's exactly the vision that we've been talking about with Ian. I think it's really exciting, because it would make hospitals a very different experience. It's kind of, you don't get excited going to a hospital, but I'm at least somewhat excited now when I go to Alder Hay, because it's like the amazing food that's come out of that kitchen. So it's making these little changes that can have a real impact.
Yeah. Zahir, have you got a question?
I think thank you. It was interesting and very sort of eye opener in many ways. I just had a question. Maybe it's a comment with Ian. I think years ago, I was working with some of the medical community when I was in London, trying to look at the role of environmental factors in TB transmission, because that's an archetypical airborne disease. And what we were very much interested in trying to sort of understand, is there a possibility to look into the environmental factors that will enhance the risk of exposure, because it's an element of risk of exposure. From then you can have a risk of infection, and then there are factors that will lead to the risk of development of disease. And every time when I was having the discussion, I think the similar thing that you had, it depends on who are you talking sometime. So what we were trying to do, whenever there was a TB incident, we'll go retrospectively to look into some of the environmental factors. And what the whole idea was this, that is there an easy way, an easy to use tool for our medical colleague to decide on the extent of contact screening, because they didn't have any sort of a model available that will be all based on the medical evidence who do the need to screen. And I'm still thinking that I think there is a lot of literature, it comes and goes about role of environmental factors. So quite often when we look into the disease, I don't know, I think having spoken to the colleagues from the clinical side, there was a time when there was quite a lot of focus on some sort of, like the pathological factors, not looking into the environmental factors. that leads to the risk of exposure and also the development of disease, because all of us are exposed to the same agents. And this is another thing when it comes to, I mean, having worked into the mold and viruses side of the thing. As of today, for example, even with this new law, okay, personally, people will reach out to us and say, is there any sort of a limit that you can say that you should not have a concentration of mold more than that in a specific building so that we can regulate it? We don't have such limits existing. And one of the biggest reason is the lack of the dose response relationships. So, but my question is around, like having sort of actively sort of engaged with the policymakers and all that. One of the easiest way, and I always think in terms of the solution, is that you try to cut down the factors that leads to the risk of exposure. Quite often our focus is sometimes looking into the reducing the risk of factors that contributes to the development of disease. So is it better, especially for the housing point of view and for the children, living, like tackling it from the social determinants of health point of view, that if we focus more on looking at those factors, they come from the environment, and rightly, like you showed some pictures, especially from the housing and all that. And then is this that our sort of a biggest barrier is the communication, or where are we failing, in all this? Because all the local authorities will have the rules, healthy homes, the healthy houses. You talk to them and then they will say, okay, the tenants are basically not sort of putting into the place all the guidance. That it's always, like the blame shifting that I see. And I think I strongly always go against it and say, look, I don't think it is about the tenant. There are inherent problems in our building stock. They were designed for a specific time, then there were so many changes into it that they're no more fit now even. And the other problem that we are now suggesting in terms of retrofitting, we are going through it, but we don't know what would be the implications of that, because it's again, like pasting something on an existing system that we don't know what comes out of this. But in your sort of an experience and view, what do you think, like, where is the barrier in terms of coming up a solution to improve our environment? I think that's the way, if we really want to tackle some sort of enhancing, let's say, or reducing the risk of exposure to all of these air pollutants.
Okay, so it was a long. So I think your question is, how do you go more upstream, and why are we not going upstream? So I mean, you mentioned about social environment. This is entirely about the social determinants of health. It's only about that, and it needs to only be about that, right? And things like housing, outdoor air pollution, food. So we've not really talked about nutrition today, but the very children who, well, you have, Jens, but my thing was about indoor pollution. But the very children, if you look at that pathological sort of schematic, the very children who are exposed to poor housing are the same children who would benefit the most from having healthy, green, antioxidant nutrition, and yet they are the children who are limited to ultra-processed food, either from a food bank or from cheap local places or whatever. So if you then take that layer of social determinants of health, you go one step back and go, okay, there's 20 things we need to fix here, so let's go even more upstream. And you realize that actually all of this stuff that boils down to two things. First is that we've spent decades in rich countries like the UK and the US telling people in poverty that it's their fault that they're in poverty. And that's what I mean by stigma, is the machinery of inequality. If you flip the switch and actually rich people were exposed to problems in, if having too nice a house, if living in a mansion predisposed you to something, and, I don't know, but if it was the other way around, we'd see a totally different thing. And when you look at respiratory disease, we see less progress on the social determinants of health than we do for other types of diseases. And we've done some work showing that of all chronic and acute disease types, respiratory health is the most inextricably linked to poverty. It's almost, unless you are born with a respiratory disease or you have a predisposition biologically to asthma or whatever, like, unless something happens, generally speaking, all respiratory disease, and to a degree a huge amount of gastrointestinal disease and mental health, is just entirely driven by poverty. So we started pushing against the 2-child benefit cap almost as soon as it came out, and we said this is archaic, this is arbitrary, it's cruel to only give 2 children in a family that financial support. And we spent a decade being told, well, if people can't afford children, they shouldn't have them, as you know, as if that's the fault of a 4-year-old. So there's this whole thing about where it gets stuck. And again, I go back to what Jens was saying about big institutions, including universities, are completely static. Like they are so difficult to get moving on stuff, and the outcomes that they're looking at are short-term things that people will say, oh, we need to be seen to be collaborating with them, and it's like, no, you don't need to be seen to be doing anything. You need to do something that has a meaningful impact. And I do think, and as much as I love our universities in the UK and certainly Liverpool is very close to my heart, Newcastle where I trained, these are great places, and they are full of great people. But the barriers to making change are things that are completely irrelevant to the lives of children. Children with TB don't care about whether one university has a formal agreement with another. Like, they just want their life to be better. But we spend our whole time chasing a load of process stuff instead of actually doing stuff that matters. The voice of the family, the voice of communities is completely lost in all of this. And so those things about better social determinants of health get lost amongst people that are a billion miles away from the actual problem. And this is where institutions like universities, I think, have an obligation to make better links at community level. If you don't know the people that you're trying to help, nothing better will happen. And you, as in academic roles, in council roles, in health roles, in leadership roles, one of the things that we don't see as our main job is to advocate for the people that we're trying to help. And we do that better when we advocate together. This is what we're doing with the food. We've set up the Right to Food Commission to have to have the right to food written into UK law, so that it brings accountability, it brings responsibility. And I think for living situations and urban infrastructure, I think we need the same thing. Children who live in cities have the right to fulfill their potential. And this whole thing for me is grounded in human rights, and the solution is grounded in human rights as well. So often the collaborations we need to make are often not the ones down the corridor, they're the ones in a completely different place with a totally different mindset.
Right, I'm aware that we're slightly over time, but I just want to give Jens the chance to address something that's come into the Q&A box at the last minute. So just maybe if you could just answer this really quickly, Jens, but Marianne has asked, how flexible is Farm Urban set up for additional plant species? So is it just lettuces, or is it going to go further?
No, we can grab anything. We're currently growing coffee, we're growing yams, we're growing kale, yep, whatever. Saffron, yep, anything. Brilliant.
Right, I would just like to extend the thanks of the Greening Network and the Reclaim Network to both of today's speakers. They've been absolutely fascinating. I think Charlotte would like to have a quick shout out for next week. There we go. So, sorry, next month. So webinar 44, this is middle of January. We've got 2 speakers here, Dr. Emma Ferranti, who will be talking about urban forestry and climate adaptation in Birmingham. And then Dr. Sumit Mishra will be talking about greening the indoors, nature-based solutions for urban sustainability. So hopefully see you all then.
Thank you so much.
Thank you.
Thank you
so
very much.
Bye.
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 Great.